we're students from the Wegman School of Nursing here at St. John Fisher College. We have some important information regarding the coronavirus to share with you from the Centers for Disease Control and World Health Organization.
Hi, I'm Claire.
And I'm Jane, and we will be discussing frequently asked questions about the coronavirus. So Claire, what is the coronavirus?
So the coronavirus is a virus. It's not bacterial. This one has never been seen before. This virus has been suspected to be linked to an animal market. However, it is highly transmissible from person to person.
And where did the coronavirus first become seen?
We first saw it in China.
Okay. And how does it spread from person to person?
So it's a communicable disease and it spreads through droplet form. So that means it spreads through saliva. So if any gets into your mouth, your nose, and if any goes into your eyes, then you are more than likely to get it.
Thank you. So Bella, what are the signs and symptoms of the coronavirus?
So the most common signs and symptoms of the coronavirus are fever, cough, and shortness of breath or difficulty breathing. And these are typically seen within 2 to 14 days of exposure to the coronavirus. You should call your doctor if you develop these symptoms, and especially if you have traveled to countries where there's widespread of the coronavirus, or if you've been exposed to someone who is known to be infected with the coronavirus.
So what safety precautions can I take to prevent from getting the coronavirus?
So although there is currently no vaccine, there are certain things that you can do to prevent the spread. So things you want to do are you want to avoid close contact with people who are sick. You want to wash your hands. So we tell people to wash their hands for at least 20 seconds. There's actually 5 steps to washing your hands. So the first step is to rinse your hands under warm water. And then you want to lather your hands with soap. And then scrub your hands for at least 20 seconds. And that includes your fingernails, the tops of your hands, back of your hands, the cracks in between your fingers. And then you can rinse them under warm water again. And you want to, a trick to washing them for 20 seconds is to sing happy birthday twice to yourself. So that's just really the most important way that we can prevent the spread of coronavirus. If you are not able to wash your hands with soap and water, you can use alcohol-based hand sanitizer. And that's another good way. And then other things you want to do are avoid touching your eyes, nose, and mouth, really anywhere in your face. That's a big way that the coronavirus does spread. And then stay home when you're sick and practice common respiratory etiquette. So when you're sneezing and coughing, either into your elbow or into a tissue, and then you throw that tissue in the garbage right away.
So I see a lot of people wearing a mask. Is that beneficial to preventing the virus?
So that's a very good question. People who are well and not sick with the coronavirus are not recommended by the CDC to wear a mask. People that are recommended to wear a mask are those who are sick to prevent the transmission to others, as well as healthcare workers. It's very important that people who are well are not wearing the mask, so then that there are a supply for those healthcare workers who are on the front line dealing with the coronavirus and people who are ill.
Okay, Sam, so how is the coronavirus treated?
So right now there isn't a specific recommended antiviral treatment or medication to treat the coronavirus. It's just working on treating those cold-like and flu-like symptoms.
Okay, and who are the people who are the most risk for developing this virus?
So anyone who is immunocompromised, has any history of a chronic illness such as diabetes, heart disease, lung disease, and also the older adult population.
All right, thank you.
Hi guys, thank you for watching. Just remember, if you're returning to campus from a level 3 advisory country, please stay at home for 14 days quarantined and do not return to campus. If you're not feeling well and you live on campus, don't go to the Health and Wellness Center. Just call them from your dorm and they'll come see you. Thanks and stay safe.